What are the most common avian diseases? Have you ever wondered what illnesses might affect our feathered friends? Birds, just like any other animals, can suffer from various diseases that impact their health and behavior. Understanding these diseases is essential for keeping birds healthy and safe. Let's take a closer look at some of the most common avian diseases and how they relate to avian biosecurity, bird behavior, and ecology. First up is salmonellosis, a bacterial infection that often affects garden birds, especially seed-eaters during the colder months. Infected birds may show signs like ruffled feathers and swollen eyelids. This disease spreads mainly through contaminated food and water, particularly in crowded conditions at feeders. Unfortunately, sick birds can die quickly, sometimes within just a few days. It's also important to note that this disease can pose risks to humans who handle infected birds, making hygiene practices essential. Next, we have avian pox, a viral disease that causes wat-like growths on unfeathered areas such as the head and legs. Birds with this disease may still feed and fly, but the virus can linger in the environment. It spreads through direct contact or contaminated surfaces, like feeders. While supportive care can help, good hygiene is the best way to prevent this disease. Trichomoniasis is another concern, especially among peons and doves. This parasitic disease spreads through saliva, often when adult birds feed their young. It can also be transmitted through contaminated water. The parasite affects the throat and crop, leading to difficulties in swallowing. Gapeworm, a parasitic roundworm, primarily affects insect-eating birds like blackbirds. Birds become infected by consuming earthworms or snails that carry the larvae. The worm lodges in the trachea, causing respiratory distress, which can be quite serious. Scaly leg mite is another common issue. These mites burrow into the skin, creating thick, crusty lesions on the feet and legs of birds like chaffinches. While many birds remain active, severe cases can lead to lameness, making them more vulnerable to predators. Avian conjunctivitis, often referred to as housefinch disease, is a bacterial infection. It leads to swollen, crusty, or runny eyes, which can be severe enough to cause the eyes to close shut. While it mainly affects house finches, other finch species can also be impacted. Polyhumivirus is particularly dangerous for young birds. This viral disease can cause symptoms like a swollen abdomen, loss of appetite, and dehydration. Unfortunately, there is no treatment once infected, so vaccination and hygiene are key preventive measures. Pacheco's disease, caused by a herpes virus, is highly contagious among parrots. It often spreads silently until stress triggers outbreaks. Birds may appear healthy until sudden death occurs, although some show signs like fluffed feathers and watery droppings. Lastly, we have bird mites and lice, which are external parasites that can cause anemia and weaken young birds. Heavy infestations can lead to nest abandonment, and while mites can enter human homes, they cannot survive long without birds. To keep birds healthy, it is essential to avoid overcrowding at feeders, maintain clean feeding and drinking areas, and minimize stress. From a biosecurity standpoint, a clean environment and limited contact with infected birds can significantly reduce the spread of these common diseases. Understanding these diseases helps birds navigate their habitats more safely and encourages behaviors that reduce transmission risks.